Good morning. Yes? All right. We will now begin with Dr. N.S. Deodhar Memorial Oration. Professor N.S. Deodhar Award was instituted on 5th of March 2020 by the Interdisciplinary School of Health Sciences, Savitribai Phule, Pune University. It is in his honor as one of the founder member of the then Biometry Health and Nutrition Department in Pune University. An able team that included Professor Sukatme, Professor Mutadkar, Professor Bhushan Patwardhan, Professor Anita Kar, together with Dr. Aarti Nagarkar, under the able guidance of Professor N.S. Deodhar, nurtured and built the school to its present stature as School of Health Sciences. As it is today, the school bears testimony to his genius. As an architect and father of public health in India, Dr. Deodhar has been the guiding force behind the school since its inception. As a public health professional of eminence, he spearheaded the cause of public health for over 5 decades. His contribution to prevention of disease and health promotion, in contrast to a curative approach, was instrumental in establishing the discipline of preventive and social medicine in India. His work received international recognition by his election as member of the International Epidemiological Association to represent the Southeast Asian region between 1981 and 84, and by the award of honorary membership of the International Epidemiological Association in 2000. He has held several prestigious positions with academic rigor and administrative flair. Professor Deodhar headed the Department of Preventive and Social Medicine at the BJ Medical College and upscaled it to an advanced unit. He had several prestigious positions during his illustrious career that was acknowledged by institutions of international repute. He was invited by the World Health Organization to develop the first national program for training medical students in community medicine, leading to an MD degree in University of Colombo, Sri Lanka. He was a chairman of the 3rd International Congress of World Federation of Public Health Association, where 51 countries participated. Dr. Deodhar has contributed immensely to the national public health services. With his able direction and leadership, smallpox was eradicated from Maharashtra. His proficiency in public health is exemplified in his incisive studies on plague outbreak in 1994, HIV and AIDS, and other national programs for tuberculosis, malaria control, and pulse polio program. His contributions are of great value to scientists, administrators, and policymakers. Some of the renowned national and international honors bestowed on him for his outstanding contributions include PHFI Lifetime Achievement Award in 2008, Ved Prakash Memorial Oration 2008, Best Citizen of India Award in 2011, Jeevan Gaurav Sanman and Patra 2011, and Dr. I.C. Tiwari Memorial Lifetime Achievement Award in 2015. Today, it's a proud moment for us to honor Dr. M.D. Gupte with this award for the year 2023. To introduce Dr. M.D. Gupte, he is currently the adjunct professor at the Department of Health Sciences. He is the founder director of the National Institute of Epidemiology in Chennai, Tamil Nadu, India. He served as chair of epidemiology at the Indian Council of Medical Research. He recently received the prestigious Vasundhara Lifetime Achievement Award. He's an MD in preventive and social medicine and an expert in public health in India. Sir has notable contributions in the control of infectious diseases like tuberculosis, leprosy, and smallpox, to name a few. Some of the key positions he has contributed in include WHO epidemiologist for smallpox eradication campaign in Uttar Pradesh in 1974, consultant at WHO headquarters Geneva on leprosy in 1980, member of the ICMR task force on immunoprophylaxis and immunotherapy of leprosy, in a national capacity as epidemiologist for the first multi-drug regimen project against leprosy at Varda. He has several research publications that have contributed to directing policy at the national level. One of his current area of interest is the One Health approach, very relevant to today's theme, as a strategy to address human, animal, and environmental health. He's been associated with the school for more than 20 years, and he continues to mentor us, the current faculty of the school. We welcome you, sir.
Good morning. It's a rare privilege for me to be over here to deliver Dr. N.S. Deodhar Memorial Lecture. I owe my present position as a scientist, as an epidemiologist, as a public health person, to two persons mainly, Dr. N.S. Deodhar and Dr. P.V. Sathe, who were my professors at BJ Medical College. I learned all my skills and knowledge through these two persons. Professor Deodhar, he was a great disciplinarian. He was a surgeon, essentially, and even though he was offered the job of civil surgeon in the earlier days, he never accepted that. He chose public health as his expertise and started working in those areas. He established under Professor Idranwala the Department of Preventive and Social Medicine at BJ Medical College. The contributions made by Professor Idranwala, supported by Dr. N.S. Deodhar, during the Panchayat floods for Pune are well known. Some of you may not know, but during that time, when the Panchayat floods occurred, Kadakosta floods occurred over here, 2 dams were broken, and Pune city was flooded with water. A vast devastation took place. And people expected, well, after this kind of displacement of population and the kind of problem that were seen over there, lots of epidemics will come up. Idranwala was the one who devised the program, and the implementation was by Dr. N.S. Deodhar. We are extremely fortunate that following the Panchayat disaster, Pune, those days Pune, did not face any such problems as far as the health issues were concerned. So that was the kind of contribution Dr. Deodhar started with. My association with Dr. Deodhar was from my internship in 1970. I was working at Bhor in a primary health center, and we got a report of cholera epidemic in a village nearby on the Pune-Satara road. The name of the village is Vedu. In those days, Vedu was a very small village with houses essentially of tiled roofs, and most of the people, there were no latrines. Water supply was very rudimentary. There were 5 wells over there. And we saw that epidemic broke up over there. As an intern at Bhor, I said, let me go and see that place. We went over there. I stayed over there for 3-4 days, 1 week almost. We established a ward, temporary ward, to admit patients to serve the villagers who were suffering from cholera. And the whole thing went on very well. And as one would expect, after the vaccination was done, cholera disappeared from that place. I'm reminded of a story by C.G. Pandit. C.G. Pandit was director of King Institute in Chennai, in Madras those days. And he got a report of some epidemic that was going on, raging. So he was supposed to go over there. He went over there. He looked up, suggested some things, and then came back. And in a week or so, a report came in Times of India those days that CG went over there and the disease disappeared. It was CG's contribution. So CG Pandit's chief, a Britisher those days, he sent him a telegram that CG, that's the kind of report I see in Times of India. Do you believe that you have done that? CG said, I never said that. It was the Times of India. It was the newspaper which reported. So whatever we did, perhaps by the time we reached over there, the epidemic was already on the top. And well, we supported, we gave support to the people, we treated these patients, and did all kinds of support activities, including purification of water and so on. But the epidemic was already going down. And that's how the whole thing started. But Dr. Deodhar was keen that I should publish that. And my first paper is about cholera management in village view. That appeared in Maharashtra Medical Journal. Nobody would think today of publishing in that kind of a journal, but that's the one which I started with. And that was because of Dr. N.S. Deodhar again. The PSM department was a very great learning experience for us. Dr. Deodhar never believed that we should learn the things sitting in the classroom. He always wanted us to go in the field, and he believed that we should be thrown in water to learn swimming. It's hands-on experience always. And that's how it all started with. I remember one of the epidemics which I investigated in those days. It was at Law College in Pune, infectious hepatitis. And we found out how it happened, what happened exactly, and so on. I was collecting urine and stool samples. Whole day I will be either teaching or doing the epidemic investigations, visiting the college, finding out the place. And in the evenings, I would start my lab work. Dr. Deodhar was responsible to provide us a laboratory. And the laboratory was available to me. So I was working with urine and stool samples in the laboratory. Around 12 o'clock midnight, one day, Professor Deodhar walked in. He said, I wanted to see why the lights are on in my department today. He came over there, he saw that what I was doing. Without a word, he left. And next day in the morning, in our meeting in the department, he said, well, I saw Gupte over there, all in blood and urine, doing this investigation. That's the biggest certificate I enjoy always, what Dr. Deodhar told me. Similar were the experiences with smallpox, similar were the experiences with a number of other things. He was always keen that we should be able to meet number of people, number of dignitaries, number of people who had a lot of experience in the field of public health and epidemiology. That's how he took me to Edranwala's house. And we had a glass of wine with Dr. Edranwala at his house. Similarly, C.G. Pandit, he was there in our department, and I walked in. Dr. Deodhar called me, in fact. I went to his room, and he asked me, what am I doing? I said, I'm on leave today, but I came for some work in the department, and, oh, that means you are free. You take Dr. C.G. Pandit for cholera vaccination. And that's how the things were going. V.N. Rao was one more person who was Joint Director of Health Services, eventually became Director of Health Services, a big name in malaria. And Dr. Deodhar was one who made it sure that I get the opportunity to know Dr. V.N. Rao, work with him. In fact, the smallpox epidemics, one of the epidemic I did investigate in Satara district in Patan area, in the hilltop. It was impossible to take a jeep over there. And I said, well, I want to see what exactly is happening. Rainy days, slippery roads. The medical officer was kind enough to provide me a jeep to go up to the base of the hill. From there, I had to walk up. I walked slippery roads and very difficult to go up over there. When I went over there, I saw a case of smallpox, separated, segregated from the village. I collected the swabs from the patient, the scabs from the patient. Came back, went to Satara in the evening, talked to the district health officer, woke him up, in fact, told him that, well, there is a case of smallpox. I'm doing my investigations in my laboratory today, but I'm telling you that, well, smallpox is there and you need to be careful about it. Well, you have collected the material, you are doing some lab work with that, fair enough. It's your academic interest. Go back. And he slept. I did my investigation after reaching Pune in the BJ Medical College. And next time I was doing gel diffusion those days. When I came back, I saw the report was strongly positive. I was asked to go to Dr. Virendrao and give him a DO letter stating all these kinds of things. The DHO was put away from his office for a few days, and Dr. Virendrao was extremely keen that the smallpox work should continue, vaccination should continue, and that's how he selected me for Uttar Pradesh work in smallpox also. So it was all Dr. Deodhar and the way the things were going. The work in leprosy I started was again something because of Dr. Deodhar. I was at Pune, I was selected as a reader, and I was supposed to go to Mumbai, but the government decided to put me at some other place, which was a very difficult place and very difficult to work with. At the same time, my interest in leprosy was very much there. Dr. Deodhar selected me as acting director of Gandhi Memorial Leprosy Foundation, and that's how my work in leprosy began. When it came to leprosy work at Gandhi Memorial Leprosy Foundation, GMLF was having several centers all over the country. And the Dapson initiative with Survey Education and Treatment Program was by Dr. Vardekar from Gandhi Memorial Leprosy Foundation. Professor Mutatkar was a member of the committee also. And Dr. Deodhar was the one who looked at the data available. And he saw, well, when Dapson was initiated, number of cases went up suddenly, which was bound to happen because survey was done and a lot of cases were being detected. So the new case detection rate went up suddenly for the initial couple of years. Then it came down because the backlog was cleared. And after clearing of that backlog, there was a plateau. There is no further decline in new case detection. And that's something Dr. Deodhar saw. Dr. Deodhar documented. Nobody wanted to believe in that. As ICT, Dapson, and as if we are going to conquer leprosy was something very much in the minds of people. The same thing we saw with MDT also, multi-drug therapy. Eventually that came up. And we launched the program of leprosy elimination. We did several tricks, if I may say that. Single patch cases of leprosy constitute something like 70% of our new cases, if you go on doing regular surveys in a population. What we did was, we devised a treatment of rifampicin, ofloxacin, minocycline as a single dose for a single day. It was very effective. We conducted trials for that. And with that, our 70% of new cases disappeared from the leprosy register overnight. In fact, when multi-drug therapy was launched, we also started doing a number of other things as well, of clearing registers for that matter. Because a number of patients were there on the register who never were supposed to get treatment. They were coming out there, but treatment was not required because it was a burnt out case. And several of those kinds of cases were there. So when WHO launched, the World Health Organization, World Health Assembly launched this program of leprosy elimination by 2000, in several African countries, simply by this clearing of registers, elimination was reached. And we saw that. The new other things that were done unfortunately, when we decided after 2000 that by 2005 we should get leprosy elimination for countries like India also. India contributed 60-65% of the new cases those days. Even now it's the same story. And 2000 to 2005, if you see the graph, the way the things were going on, leprosy came down very sharp. And 2005, we were supposed to reach leprosy elimination of less than 1 per 10,000. We reached that. The trick was, whatever new cases were coming up, we kept them for the next year. We will not report those cases today, we'll report them next year. Even today, our new case detection rate, perhaps showing a small declining rate, but otherwise it's very much the same. During COVID-19, we saw that our case detection was getting behind very much. And this year particularly, and last year, 22 and 23, 22 in particular, we saw a number of cases coming up. In Gujarat, we saw several of those cases coming up with advanced lepromatous leprosy with lot of deformities. So the program that we launched and the decision that we made that we should eliminate leprosy by 2005 was not really achieved. And we keep on talking about it. So the message that we give now, persons like me, that forget about elimination, forget about eradication. We know that leprosy has come down. Advanced leprosy is not very much seen because we have been detecting leprosy cases fairly early. There was a focus on leprosy of consequence at some stage, where we started looking for leprosy with deformities, leprosy with acid-fast bacilli, nodules, and so on. Now, that thing changed subsequently. And now the focus is again back on start detecting leprosy early, go to the community, make them active. So same treatment, same strategy that we adopted for survey education treatment is now coming back. So the message I give is forget about elimination, forget about eradication, because this is the bacillus which is going to stay with us for a few thousand years. If that is so, the disease will persist, because the disease is not only restricted to human beings, it's perhaps available, perhaps there in the soil, the bacillus, perhaps there also in some animals, and we have no means to eradicate leprosy. So we go back to leprosy control. That's the message I keep on saying now. Well, of course, we know that when it comes to leprosy and do all those kinds of things, these messages are very difficult for people to accept. Dr. Deodhar was associated with the leprosy vaccine trial that I initiated. He was our chairman also. Because wherever I was, I wanted him to be available. I wanted Professor Sathe to be available to guide us. And he readily used to agree and be available with us. But the fun is, Dr. Deodhar, if he found something against his thinking, against his principles, he will simply leave the place, resign from the place, and would say, well, I'm not going to continue. There was one vaccine available from Maharashtra, from Mumbai. That was ICRC, Indian Cancer Research Center, developed by ICRC, by Cancer Research Institute in Mumbai. Dr. M.G. Dev was director at that time, and he was interacting with Dr. Deodhar. I was also, of course, with Dr. Deodhar. But then Dr. Deodhar felt that, well, ICRC vaccine is developed by somebody, is being now developed by somebody else, and he wanted to take it up for the trial and number of other things he had in mind. So he decided he will not continue to be chairman of our committee, and he left it. The same thing he did also when we started National Leprosy, National Institute for Epidemiology at Chennai. He was the first chairman. He developed with us the blueprint for how we should go about at NIE. And at some stage, when the issue came up about what should be the name of NIE, whether it should be Epidemiology Institute or epidemiology and biostatistics. And some other issues came up. So the same thing again, Dr. Deodhar stepped down. He said, well, I don't want to continue as chairman with you. And he left it. He did the same thing also with the Government of India. In fact, he was Additional Director General of Health Services. He should have been Director General of Health Services at that particular time. But somehow, knowing Dr. Deodhar, I believe the policymakers thought that we want somebody who is malleable. And Dr. Deodhar is not one of that kind of thing. He could never be. So they selected somebody else. And Dr. Deodhar had that time 5-6 years. He said, well, no, I don't want to continue. And he left the job. He resigned, premature retirement. Dr. Deodhar's brother, P.S. Deodhar, who is a well-known person in engineering, he was advisor to Rajiv Gandhi, who was Prime Minister at that time. So P.S. Deodhar was told that why don't you talk to your elder brother, N.S. Deodhar, and tell him that he should continue. He should not leave like that. And P.S. Deodhar's answer was, well, I don't think he can ever agree with me. If he has resigned, he has resigned. We should accept it. So that's the way Dr. Deodhar's things were. You already heard about the professional journey of Professor N.S. Deodhar, so I don't want to repeat those things. I will only tell you about John M. Last. Now, John M. Last, people who have seen the earlier textbooks of public health, we used to have Maxi Rosenau textbook for public health. And it became Maxi Rosenau Last. He was one of those editors for the public health book, Maxi Rosenau and Last. Now, Dr. Last also is the one who developed epidemiology dictionary. Some of you might have seen that. I happened to meet Dr. Last in Japan in one of the conferences. I was talking about ethics in that conference. He was around. I talked to him. He said, I know of only one epidemiologist from India, and that is Dr. N.S. Deodhar. No other person, Dr. N.S. Deodhar. So that's the kind of thing that I heard from Dr. Last. Dr. Last is a peculiar personality, came from Canada. The way he says, he had strong principles also. He says policymakers and the public health leaders are the ones to whom I am responsible. I have to answer them. And therefore, I will express my views all right, but eventually I will have to abide by what the policymakers, what the politicians want. So Last was in that mode, in that mold, and he went on that way. Dr. Deodhar was not of that kind. Dr. Deodhar was a very straightforward person, and he always remained that way, and that's the way he developed his own students also. One of the examples of his work I will tell you about is the plague outbreak of 1994. I don't know how many of you know about that plague outbreak. The seniors would know it. In Mamla village in Beet district, there was a report of rat fall, and there was a report also of flea nuisance. There was a report also of cases coming up in that area with lymphadenitis, in the groin in particular. They had collected some samples, they had seen all these pictures, and they thought that perhaps this is plague. If you know about plague, plague is a very severe disease, used to be at least. Now we don't see much of plague. And the kind of fever that would come, the malaise that will develop, septicemia that will come up, and a large number of people will die of plague. That's the kind of picture, clinical picture that we see of plague. Dr. Deodhar looked into Mamla village episode. A few months later, there was a report also from Surat of pneumonic plague and deaths over there. And the effect of pneumonic plague report from Surat was people left the place, fled away from the place. Dr. Jacob John has documentary on that. And he said, well, this is the common thing that was going on. There is nothing special because of plague per se. Nobody bothered about it, what people were saying. Dr. Deodhar made a very meticulous study, along with a couple of other people. And the director of National Institute of Virology was also involved in that. Dr. Yemul, who was professor of pathology, was also involved in that. And Dr. Deodhar was the main architect of this particular article that he developed. I read about a story about some commentary by Dr. Lele, who is a famous physician from Mumbai, a very learned person, very well accepted person, in India at least. And he says that, well, plague reported from Amla, plague reported from Surat, was never confirmed as plague. And he says, what Dr. Deodhar has done, looking at the clinical definition of the pictures, of the cases that were seen, looking at the epidemiological pattern that was over there, looking at various laboratory investigations about culture. Can you believe ever that a culture from the fresh samples for Yersinia pestis was always negative? And the advisory committee that came up, they collected some samples from very old patients, old samples at least. And those samples were processed not only in India, not only in Afghan Institute, but 3 other places of international organizations. They did that. And they found that, well, perhaps this is plague. They never said confirmed plague. And Dr. Deodhar says, looking at all these things, what we had in Mamla village in Bid and we had in Surat was not plague at all. You need to investigate further. You need to look into it, what it was. And these kinds of cases keep on coming up in Bid. At least after 94, couple of years, there were reports. Surat also, there are some reports of that kind. And never we saw ever the kind of plague picture, the clinical picture, the epidemiological picture, the ratfall that comes up just before the plague, and the cases that follow in human beings subsequently. If you look at those kinds of things, there's no pattern of that kind of thing. Plague doesn't disappear overnight. Plague continues for few more years. That never happened with both these places. It just disappeared. It was never a plague case. And this was the kind of thing Dr. Deodhar investigated. Dr. Deodhar reported. So when it comes to Dr. Deodhar, I'm reminded of several of those kinds of things. There's a famous story about Sakan oil mills. I'm sure Professor Mutatkar would remember that. What we saw was epidemic dropsy. And nobody thought that perhaps from where it came. Sakan oil mills managers, owner, they cleared the tanks in which the oil was stored. Dr. Deodhar investigated that. What he did, he got down himself into those tanks, took some cotton swabs, collected the sample from the corners of the tank, and demonstrated it was Argemone mexicana oil, which was contaminating, which was definitely added to the oil that was being sold by Sakan oil mills. And that's how the epidemic dropsy came up over there. So several interesting stories like that. Dr. Deodhar was recognized widely at global level by WHO, by several other organizations. He was the only honorary member of the International Epidemiology Association when he became member. I think C.G. Pandit was one, followed by that Dr. Deodhar. And this is how the story of Dr. Deodhar goes. Dr. Deodhar was keenly interested in infectious diseases, apart from several other things. And that's the thing which I try to take it up further with Dr. Deodhar's telling us. I've got a few global pandemics listed over here. And you can see the Antonian plague of 165 AD. This was perhaps one particular episode which was well documented. And you can see the photograph of, or the bust of this particular Roman king. He himself suffered from plague and recovered. fortunately. He was trying to expand his kingdom beyond Rome in the Far East, in the close East from Europe, near the Mediterranean region. The warriors who came back brought plague along with them, and he also suffered in that process. So that's what Antonian plague and several other things that listed over here. 11th century saw leprosy epidemics also. You'll be quite surprised to see that. But there were epidemics of leprosy in the 11th century. Columbian exchange is a very interesting thing. When Columbus went to America, discovered America, he brought along with him to America several communicable diseases. Even today, people keep on discussing whether syphilis was brought by Columbus or whether it was already there. But several of those kinds of things, smallpox, syphilis, and several other conditions came up with Columbus to America. And the Native Americans, in large number, were killed by these kinds of things. As you can see in this thing, research in 2019 even concluded that the deaths of some 56 million Native Americans who were buried in the soil. And when the tilling was going on subsequently, they could hardly do anything. A lot of carbon dioxide was produced, which was responsible perhaps for the global temperature coming down that particular time. Carbon dioxide increased and so on. So this is one more such kind of interesting thing that happened. 1347 Black Death. The 1665 Great Plague of London is a very interesting story again. This plague was going on in London for several years, several decades. As we know of plague, every 3-4 years a new cycle will come up. The rat population will be killed. When they rejuvenate again, plague will also come up along with that. Again death followed by plague in people, and that's how the things were going on. In 1665, along with plague, there was a great fire of London also. And with that great fire, nobody knows how, but plague disappeared. Subsequently, when plague came up in Hong Kong, you won't believe the lower areas of Hong Kong were all burnt out, purposely. They said, if you want to control plague, you should burn all these houses, all these areas, and that's what the containment policy was for plague in those days in Hong Kong. I have listed smallpox also here. 15th century smallpox, and that's why I got this photograph of gender. The vaccine which prevented or eventually was responsible for eradication of smallpox. It took 200 years. C.G. Pandit was again the one who commented that time. When smallpox was eradicated, this was the message. C.G. Pandit said, well, we had the vaccine for past 200 years. We never knew how to use it. And the person who developed this particular strategy was a very peculiar kind of thing. In Africa, in one of the countries where Bill Fagey was working, he found the smallpox vaccine was not available to cover the entire population. As we believed some 90% coverage for smallpox vaccination, if it is done, you develop herd immunity. Now to get that kind of vaccine amount was not available. So he said, well, we have no choice but to identify the cases as early as possible and do some kind of ring immunization around that. Subsequently, vaccine became available. But before that, this ring vaccination strategy was responsible for eradication or elimination of smallpox from those areas. Now, Bill Fagey was the one who was working in smallpox in India. He was working in UP with us, he was working in Bihar, and the kind of work I could do with him was again something very, very interesting. Several things that we developed in Moradabad district. Now, Moradabad district is a very peculiar district in UP. It was in western UP, and lots of Muslim population. They were all against vaccination. They never wanted to have the vaccination. The first time when I went to Lucknow and we were demonstrated how the vaccination is to be done, they found a small child. They called that his father was around. He was trying to say no vaccine should be given. He agreed eventually. Vaccination was done. And as soon as the vaccination was done on the arm of the child, the father came, really sucked up the whole thing with his mouth and spitted it away. Now that was the kind of thing that we saw. One of the villages, Amroha, Kamal Amrohi's village. There's no possibility of doing smallpox eradication in that particular village. Nobody was interested in getting vaccine. And smallpox cases kept on occurring over there. I went over there. We stayed the whole day trying to persuade these people. They said there's one person called Pahalwan who can lead the entire village. If he agrees, all the villagers will agree. We went to his house, talked to him, spent a couple of hours with him. He went away. He said, I don't want to listen to you. You have told enough. I have heard. I'm not going to act on that. And he went away. We said, we are not going to leave the village unless we finish our work. Tried to persuade them, tried to tell them again and again. A medical officer who was working with me, he said, sir, let me try. I said, okay, go ahead. We found that Pahalwan again. He was sitting somewhere. We went to him. And I said, Hindi, I will tell you in Hindi, मैं मेरी पगड़ी उतार के आपके पैर पे रखता हूँ. Which means I am leaving all my life at your feet. And what you want me to do, I will do that. That man stood up and went away. We never knew what to do. We found the whole village was lined up to receive smallpox vaccination. Now that was the kind of thing that was going on. Muradabad was one district where we have faced lots of difficulties in polio elimination also. We had to give 5, 6, 7 rounds of polio vaccination in Muradabad. And I was responsible for eliminating or removing smallpox zero status in Muradabad. So I always enjoy that kind of story, the way the things were done. A number of things that I can keep on telling you, number of stories like that I can keep on telling you. Spanish flu is one more such kind of things. But here, the story is we had all the information, all the tools available recently. At that time, when the First World War was over, and people started enjoying and rejoicing, we also know that influenza was going on. And they never bothered about it. And you can see, perhaps I got a photograph. No, I don't have the photograph here. So the kind of thing that was happening, lots of people died, lots of young soldiers died, huge number of them. And these people who died, they were all buried in snow, or they got buried eventually in snow. A team of doctors had to go over there, team of investigators had to go over there, exhume those places, found out the bodies, and then were able to identify from one person the virus of influenza, which was proved to be H1N1 eventually. And with that kind of thing, those techniques are available today. In fact, you have got several things available to Pune University also, Savitribai Phule, Pune University. And you are extremely lucky that you have got that kind of thing possible. With School of Health Sciences, you can develop, the students of School of Health Sciences have got all access to several of those kinds of investigations possible. And they can learn and they can develop those kinds of things. Yeah, this is the picture that I was telling you. The Armistice Day celebrations of 1918 which were responsible for recurrence of influenza in a very big way. 2 years subsequently, 1 year and 1 more year, and large number of deaths did take place. Now, influenza is one which is responsible for taking us further. We know that influenza occurs because of the birds. The birds are waterfowls. Large number of them were found in China, and from them the virus will go into swine, and from them, after jumping from that, it will come to human beings also. Now, H5N1 is one such kind of virus which was occurring around that time, around very recent time. And so 1994 we had these cases of influenza coming up, particularly in Hong Kong. And what happened was it was found to be H3N1. Now don't bother about this slide. H3N1 was the one which was picked up. H5N1, sorry. H5N1 was the one which was picked up. Now H1, H2, H3 were established as pandemic responsible influenza viruses. But H5 was never heard of that time. It was the first kind of report that came up from a small child who died in Hong Kong, in the Queen's Hospital. That sample was investigated in Rotterdam, and they found that it was H5. And that was a big news. Now, H5N1, when it comes in human beings, they felt that perhaps it's a beginning of a new pandemic. And when it was supposed to come like that, the interest, because of flu, in One Health approach grew up immediately. There were a number of things that were taken up subsequently, and we came to the finally the One Health approach. You will find that health transition was one thing that was going on for several years. Aidan Cockburn, a distinguished epidemiologist at Johns Hopkins and who was also WHO advisor, told us that evolution and eradication of infectious diseases is possible. If we do that, we can forget about control. Because once you eradicate a disease, there is no need to go further. Again, to quote C.G. Pandit, he was saying that, well, the cost of control is continuing surveillance. And if you don't do that, if you don't want to do that, you need to have eradication. And that's how the things were coming up. Same time around, from 1940 onwards, we had several vaccines available, several chemotherapy, antibiotics that were available. And you're going to hear a lot about AMR, antimicrobial resistance, so I won't get into that area. But those things were coming up subsequently. But in those days, 40s onwards, we had all these tools that were becoming available. It was an age of hubris, as you can see over here. People were extremely happy that, well, we are going to now control, eradicate, forget about all kinds of things. And they said, we are going to have only fixity of biology now. Only diseases that will perhaps we need to worry about are plague, we need to worry about cholera, and we need to worry about rabies. So three diseases only, and we can forget about all other diseases. A very rude shock when HIV epidemic came up in the 80s. And with HIV epidemic, people again became very much aware that, well, infectious diseases are going to continue. And if infectious diseases are going to continue, we cannot afford to forget them. So the international health regulations were changed. In 2005, we found something else. And we got, the way forward was One Health. And you are going to listen to One Health approach also in a short time from now. So I don't want to talk more about One Health, except okay, I will tell you something about Calvin Schwab, 1984. His book is the one which tells us about public health about animal health, public health. And he says that the final objective of veterinary medicine does not lie in the animal species that the veterinarian commonly treat. It lies very definitely in man and above all in humanity. Now this is a very strong message. I don't agree with that. As we know that whatever that we are part of the nature. Animals are part of the nature. Environment is all around us. And if we say that all that we do is only for human beings, how correct we are? We have to look into everybody. And if we want to do that, there is no escape but to go for One Health. And this One Health approach, if you want to do, look at this diagram. It's not one single person, one single particular kind of discipline which is going to develop this. You need several kinds of people, several kinds of disciplines, several kinds of, not only health related. You need to look into economics, you need to look into anthropology, you need to look into ecology. All those things will have to be kept together. It is no better place than School of One Health. Who should look into it? And I strongly advise you that at least in your course have a place for One Health hereafter. Thank you very much.
Values, discipline, and ethics are fundamental to pursue science. Thank you, sir, for that key message. We are fortunate to have witnessed these precious moments, and we are touched by your experiences. And we hope that your message benefits the future public health professionals who are seated here, our students. May I now request Professor Mutatkar, sir, to honor Dr. Gupte with Dr. N.S. Deodhar's Oration Award for the year 2023. Yes, and I request all the dignitaries, our head of the department also, to come for a photograph. Yes. Yes, ma'am. Why it is not working? Just one minute.
In my presentation, you have one.
But this is fine. But it's not visible. It's not visible. It's intervened. Swapne? Where is Swapne? Minimize this. This the workers करत नहीं है. So sorry to keep you waiting. Oh, so but no, now that you have said I have to do it, wait a second. Extra. Yes. Yeah, we got it. We'll just make it full screen. Full screen? How do I make it full screen? I don't know how this works, but we'll keep it like that.